So in the past debate that happened on Tuesday this past week, Elizabeth Warren was put on the spot for her Medicare for All position. And it was very interesting to see that after the debate, it was a little bit of a twist. So let me just get to her exchange with Pete Buttigieg here, who calls her out. And he had been calling her out on past TV shows. He was going on CNN and a bunch of other shows, talking about how Elizabeth Warren isn't being honest about raising taxes to fund Medicare for All. And she's not answering the question directly, and that's true. He's right. So now he actually has an opportunity to call her out directly to her face, and they were standing next to each other at the debate too. So it was a prime opportunity for Buttigieg, and then I'm gonna give you guys a little bit of a not so shocking surprise here, but check out this clip first, and then we'll talk about it on the other side.
Senator Warren, to be clear, Senator Sanders acknowledges he's going to raise taxes on the middle class to pay for Medicare for All. You've endorsed his plan. Should you acknowledge it too?
So the way I see this, it is about what kinds of costs middle-class families are going to face. So let me be clear on this. Costs will go up for the wealthy, they will go up for big corporations, and for middle-class families, they will go down. I will not sign a bill into law that does not lower costs for middle-class families.
Mayor Buttigieg, you say Senator Warren has been, quote, evasive about how she's going to pay for Medicare for All. What's your response?
Well, we heard it tonight, a yes or no question that didn't get a yes or no answer. Look, this is why people here in the Midwest are so frustrated with Washington in general and Capitol Hill in particular. Your signature, Senator, is to have a plan for everything, except this. No plan has been laid out to explain how a multi-trillion-dollar hole in this Medicare for All plan that Senator Warren is putting forward is supposed to get filled in. And the thing is, we really can deliver health care for every American and move forward with the boldest, biggest transformation since the inception of Medicare itself. But the way to do it without a giant multi-trillion-dollar hole and without having to avoid a yes or no question is Medicare for all who want it. We take a version of Medicare, we let you access it if you want to, and if you prefer to stay on your private plan, you can do that too. That is what most Americans want. Medicare for all who want it, trusting you to make the right decision for your health care and for your family, and it can be delivered
Thank you, Mayor.
without an increase
Senator,
on
your
middle-class
response?
taxes.
So yeah, I mean, Elizabeth Warren again got put on the spot there. She, nobody likes Pete Buttigieg. Nobody likes this guy. He's too much of a centrist, faux aggressive guy, and he embodies exactly what is wrong with Democrats. Even though he talks about how everybody on Capitol Hill is this and that, and he's basically chastising Capitol Hill for being these kind of opportunistic type politicians. That's exactly what he is. He just happens to be a mayor from South Bend, Indiana. Middle of nowhere, basically. Well, to be fair, not middle of nowhere, but it's in the middle of the country, and it's far away from, any, kind of coastal elite type states, like California, New York type stuff, Washington. But he embodies exactly what is wrong with the corporate Democrats out there, because he pushes for ideas that people think they want, but they don't actually want, and they only like it because he makes it sound good. And to be fair, Elizabeth Warren has done the same thing when she talks about Medicare for All, because she talks about it in the context of how, I'm not going to be raising taxes. I'm not going to be raising taxes on middle class Americans or regular Americans, but in reality, what you should be pointing out is the fact that if you're going to raise the taxes, which she would have to, so she's honestly either lying or she's come up with some weird loophole. But if you, like I've said before, if you raise the taxes on middle class Americans, when it comes to funding Medicare for All or healthcare system, any kind of healthcare system, you're going to see the reward in paying lesser co-pays, premiums, and deductibles. And your medical bills are going to go much, much lower. She doesn't say that because my guess is, and I said this before, my guess is that she doesn't want to copy Bernie Sanders. I get that. That's a perfectly understandable reasoning if that was the case. But obviously she's not going to admit that. But that is true. That's what it is. To me, that's going to be the only reason why she's not saying the same thing as Bernie Sanders, is because she doesn't want to copy him. I get it. Honestly, it's an understandable position because you don't want to just be a copycat for somebody else. But then again, she does keep saying, I'm with Bernie, I'm with Bernie, I'm with Bernie. So I don't know. Who the hell knows? But at the end of the day, her position is just not good. She doesn't know how to explain it in a real convincing manner, you know? So, you know, Pete Buttigieg and all of his, you know, sliminess as the corporate Democrat, you know, elitist, you know, asshole that he is correct in calling her out for this. So I give him credit for that. So the not very shocking surprise that I wanted to let you guys know about was the fact that Elizabeth Warren has waffled on how she is going to pay for Medicare for all, and she is, quote, looking at other revenue options. So this article from CNN, and remember the debate was from CNN, so she tells CNN apparently, as they detailed in this article, that, and this is the title of the article, it says, day after debate, Elizabeth Warren's campaign says it's reviewing, quote, other revenue options for Medicare for all. So basically that means that she is not going to be pushing for Medicare for all. That's how I see it. Because at the end of the day, you're not doing the same thing as you initially promised. So all this time about talking about, oh, I'm not going to, you know, I'm not going to raise the taxes on middle class Americans, blah, blah. Like, yeah, you said that, but at the same time, that's the thing though, you have to raise taxes on middle class Americans to mitigate any kind of copays, premiums, and deductibles that they would be paying, and lessening their medical bills. So again, that's how Bernie Sanders has explained it, and Elizabeth Warren is too scared to explain that because she wants to have just enough room so she can waffle on it. So let me read this article for you guys, a couple of parts from this article, and then we'll discuss it as we go along. It says Elizabeth Warren's campaign said on Wednesday that it is studying a range of options for paying for Medicare for all, leaving open the possibility that the presidential candidate may ultimately diverge from Senator Bernie Sanders on how his sweeping health care plan, which Warren has endorsed, would be paid for. She's reviewing the revenue options suggested by the 2016 Bernie campaign along with other revenue options, but she will only support pay-fors that meet the principles she has laid out in multiple debates. I don't know what that means. She hasn't laid out any principles, but anyway. And that's coming from a Warren aide who said this in a statement provided to CNN, unnamed aide. It says the campaign aide also said that the total cost of Medicare for all is unknown and that estimates vary by trillions of dollars. So based on what? It says they did not provide details on what other revenue options the campaign is studying and declined to comment on whether Warren may eventually put out her own details on paying Medicare for all. Okay, so let me translate some of these things for you a little bit. Okay, well, first of all, I'll just translate the bullshit. It says that the total cost of Medicare for all is unknown, and that estimates vary by trillions of dollars. That's not true. There's a couple of studies that have come out. I believe the one that Kyle Kalinske has mentioned is from University of Amherst, I believe. It has mentioned that the Medicare for all bill will be $34 trillion or $32 trillion. No, I think our current system is 34 trillion. Now what I've heard is that the cost ranges from 34 trillion to 48 trillion. That's what I've heard. And I covered that on past podcasts as well. But the Medicare for all plan based on the University of Amherst is $32 trillion. That's how much Medicare for all would cost. Currently, our system is more than that. So you're saving money by doing a Medicare for all system. And so this just doesn't make any sense. They're obviously not looking at the right studies or, you know, talking to the right people, or they just don't really care to do it. They don't want to get into the details of it clearly. And the fact that they don't want to provide details on what, quote, other revenue options they're studying is because they don't know. And they can't come up with anything that is going to please Elizabeth Warren's corporate donors. And since she wants to please those people, she's taking a step back, and she's she's saying that, oh, okay, don't, I don't want to give all the details yet. And I don't want to give it all the way. I don't want to give away the farm just yet. But let me get back to you on that later on. So she basically doesn't know. She doesn't know what the hell she's going to do, clearly. And that's how I see it. And then they say they declined to comment on whether Warren may eventually put out her own details on paying for Medicare for All. But that's the thing. Doesn't believe in Medicare for All. If she truly believed in Medicare for All, she would have put out a bill herself instead of just saying, oh, I'm with Bernie. I'm with Bernie. I'm with Bernie. Now, she co-sponsored Bernie's Medicare for All plan. So, I mean, give her credit for that. And as, 15 other Democrats did as well. That's fine. Like, I appreciate that. But at the same time, it's like, you clearly don't believe in it. Otherwise, you would have either said, I just support Medicare for All, or she would have came out with her own legislation. That's a Medicare for All type system. And she didn't. Bernie Sanders did. So that's just, she's just basically she didn't expect Bernie Sanders to do that, obviously. And when he did it, he ended up getting ahead of the 8 ball on that one. And the next paragraph here says, a new study by the Urban Institute released Wednesday said that federal spending on healthcare would increase by roughly $34 trillion under a single-payer plan similar to Medicare for All. That's in line with the earlier studies that pegged the cost at around $32 trillion. While Sanders has detailed how he would raise the revenue needed to pay for Medicare for All, he included a variety of options when he released his 2016 campaign proposal and his updated bill in April, which is the Medicare for All Act of 2019. Among those listed in his most recent iteration are a 4% levy on employees, exempting the first $29,000 in income for a family of 4. This is, by the way, something that he mentioned when he made the appearance on Stephen Colbert's Late Show, and Colbert asked him, how are you going to pay for it? And this is how he explained it. And that was the night after he had Elizabeth Warren on, and Elizabeth Warren couldn't answer it. And this is how I covered this on a couple podcasts before. So, he also suggests imposing new taxes on employers, hiking the marginal tax rate on those making above $10 million, boosting the estate tax, and establishing a wealth tax. That's very good. I like that. The fact that he wants to hike the marginal tax rate on those making above $10 million, that's very, very good. Warren's campaign statement comes on the heels of a contentious presidential debate Tuesday night in Ohio, where Warren was asked no less than half a dozen times on stage about whether Sanders' signature healthcare platform would raise taxes on the middle class and how she would like to pay for it. Every time the Massachusetts Democrat, standing squarely center stage as a new frontrunner in the 2020 Democratic race for president, refused to state that taxes would in fact go up for some Americans under her colleague's plan. So she's misrepresenting Bernie's plan? Is that what it is? Instead, she stuck to a well-rehearsed response about how costs would go up for corporations and the wealthy and would come down for middle-class families. She pledged that as president, she would not sign a health care bill into law unless it lowered costs for average Americans. Sanders has also stressed that while he would impose taxes on the middle class, they would see that their overall costs go down because they would no longer have to pay premiums, deductibles, or co-pays when they seek care. Yeah, Elizabeth Warren has been super vague when it comes to what she's going to do regarding the revenue options. Yeah, so when it comes to how she's going to put together revenue to pay for Medicare for All, she never goes into the details. She just said, "Oh, people are going to be paying less, and the cost will not go up." Blah 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 blah. She's just I'm glad CNN is pointing out how it's well rehearsed, because it is well rehearsed. And I've heard the same exact thing from her from every single debate, every single conversation, every single town hall, every single interview. She repeats the same shit, same rehearsed talking points. And she clearly does not understand that people are not buying into her bullshit. At least the people that are progressives and leftists that support Bernie Sanders. Next part here says Warren's repeated dodges on questions about whether Medicare for All would result in higher taxes are notably out of character for the senator, not really, whose candidacy for the White House has gained steady political momentum in large part thanks to her abundance of policy plans and a knack for explaining and advocating for those ideas clearly out on the campaign trail. I get so annoyed when they say this about Elizabeth Warren, pretending as if, I have a plan for everything. I explain everything in detail. That's not Like, okay, if she even does that, like, why don't they ever say that about Bernie Sanders? As if Bernie Sanders hasn't detailed how he's going to pay for things, as if he hasn't put out an abundance of policy plans. They portray Elizabeth Warren as if she's got all the answers and she's like saying everything so perfectly and in a perfect details and stuff. Like, that's not true. That's, and if it is true, it's not more true than what Bernie Sanders is doing. That's what annoys me. Like, if you want to say she's doing that, at least give the same credit to Bernie Sanders, but they don't do that because they can't make Bernie Sanders look good, God forbid. If Bernie Sanders ends up looking good, the corporate bosses at CNN are not going to like it, for sure. Next part here says, less than 4 months out from the Iowa caucuses, Warren's support for Medicare for All has stood out as a rarity, even as she has unveiled policy plans at a rapid clip. Since launching her campaign on New Year's Eve on the issue of healthcare, Warren has chosen to hold back from releasing a proposal of her own. Instead, she has stuck to publicly backing Sanders' Medicare for All bill, which is grifting. A bill that she co-sponsored in the Senate, and has not said that she will release a comprehensive healthcare plan for her own in the 2020 race. I'm with Bernie, Warren has previously said when asked about her vision on healthcare. Tuesday's debate laid bare the political risks of Warren's backing of Sanders' Medicare for All, and foreshadowed that she is likely to continue confronting questions and criticism about tax hikes that could result from Sanders' proposal. Clearly, she hasn't thought this whole thing through. So when she goes out there and says how she's with Bernie and she supports Bernie's bill, she clearly doesn't support raising taxes, when she can easily just, she should be saying that if you want to be, if you want to be fucking honest, that you should be saying that. You should be going out there and just being honest with the American people, instead of just saying, I'm with Bernie, but at the same time, you're not even saying, you're clearly not thinking about how, when you say you're with Bernie, you're going to be raising taxes on the American people. Be honest with them and tell them what you're exactly going to do. And when Joe Biden says that Elizabeth Warren is vague, he's right. He's not right about saying that when he says that about Bernie Sanders. Saying that Elizabeth Warren is perfectly fine. Pete Buttigieg calls her out. Biden calls her out. They're right. But obviously that doesn't make them much better. But they are right when they're calling her out on that specific thing, because she is being vague and she refuses to get into details on it. And I don't know. I don't really see it as much of a. I don't see it as much of a difference from what I've always kind of seen from her. Mostly when I see her talk, I just see her putting out like platitudes and platitude sandwiches and cliches, and so trying to sound all folksy and laughing and stuff. Yeah, so I don't really. It's hard to take anything she really has to say seriously. Let me just read the last few parts here. It says the grilling continued well after the debate ended. In an interview with CNN anchors and analysts later that spanned close to 20 minutes, Warren was again pressed multiple times to acknowledge that Sanders' Medicare for All plan would result in tax hikes for some American families. Once again, she stuck to her script. My commitment is I will not sign a bill into law that raises costs on middle-class families, Warren said. There have been earlier signs that Warren and her campaign were leaving open wiggle room on Medicare for All. At a town hall in Keene, New Hampshire last month, Warren referred to Medicare for All as a, quote, framework, saying, right now, what we've got in Medicare for All is a framework and it doesn't have the details. Again, that's fucking bullshit. I debunked that whole narrative that she put out there. Again, that's clearly something that she got from her advisors and consultants. I completely debunked that framework, ironically, I'm using the same word, that narrative, because Bernie Sanders has mentioned the framework. He's mentioned it as more than a framework, so he's gone into the details of it, claiming that then it doesn't have details. There's tons of details. But second of all, and even more importantly, she supported the Senate bill in that Bernie Sanders, that was authored by Bernie Sanders and co-sponsored by not only Elizabeth Warren but 15 other Democrats. So when you're talking about how Medicare for All is just a framework and it doesn't have the details, then what do you think the bill in the Senate is? Let alone the bill in the House too, which is under Pramila Jayapal's is being spearheaded by Pramila Jayapal, who's the representative from Washington State. She has her own Medicare for All bill, which is a little bit different and actually better than Bernie Sanders, from what I hear. It has a 2-year transition period. Bernie Sanders has a 4-year transition period. So it doesn't. It is not just a framework, and it does have all the details. So she's just lying. She's honestly, I don't even think those aren't even. That's not even her being stupid. She's just. Well, it's politically stupid, but she's lying. That's a lie. That's not true at all. That it's just a framework and doesn't have details. So she needs to cut it with that bullshit, because that is not fucking true at all. So. Yeah, stop fucking lying, Liz. We know what the details of Medicare for All is. We know that it's more than just a framework. It's a fucking Senate bill. It's a fucking House bill. So just cut it with that bullshit. So this is the thing with Elizabeth Warren. As I've detailed multiple times, and I'm going to be getting into another story soon about how she shouldn't be trusted. But this is another thing with Elizabeth Warren. You just can't. You don't know which way she's going. Left or right. Left or right. Left or right. She's not consistent. She's not detail focused. She's not policy focused as much as the people want to claim to be. And even if with the policies that she has put out there are all milquetoast half measure policies. So even if she does have, I have a plan for that, and I have a policy for that, and I have all the details for my plans, they're not really that good of plans. And that's just like the plans that I've explained here, just like I've gotten into detail on this and in the past podcasts, the past segments I did here too. Her policies are not better than Bernie Sanders, but she makes it seem as if they're fucking wonderful, and apparently they're the same as Bernie Sanders, but somehow they're better than Bernie Sanders, but Bernie Sanders isn't considered as the better candidate. She is. For what? But we don't know for what. That's the problem. And the media it's basically just a media manufacturing media. The media is manufacturing consent to make Elizabeth Warren more palatable so that they can talk about how she's wonderful and Bernie Sanders is too angry and he yells too much and he's too old. And he's got a heart problem, so he's going to drop dead tomorrow or some shit. This is what the media is going to do. And luckily, I think the tide is starting to turn, and people are starting to notice that Elizabeth Warren, now that she's a front runner, or has become much more of a front runner in several polls, that people are starting to, poke holes through her plans that she apparently has a plan for. All her ideas that she apparently has a plan for, everybody's starting to poke holes into those plans. So she's being exposed, and that's going to continue to happen, and it's going to only be only going to lead to the benefit of Bernie Sanders.